If you understand Medicare Part A and Part B, there is one more term you are almost certain to encounter: Medicare Advantage. And this is where Medicare can become confusing. So let's start with a basic question. Does Medicare Advantage replace Part A or Part B? The answer is neither one individually. Medicare Advantage, also called Medicare Part C, is a different way of receiving your Medicare Part A and Part B benefits. Here's the simplest way to understand it. With Original Medicare, the federal Medicare program provides your Part A and Part B coverage. Part A primarily covers inpatient hospital care. Part B covers doctor visits, outpatient care, preventive services, and other medically necessary services. With Medicare Advantage, you still have Medicare, and you must remain enrolled in both Part A and Part B. But instead of receiving those benefits through Original Medicare, you choose a Medicare Advantage plan offered by a private insurance company approved by Medicare. That private plan becomes the primary way you receive your Medicare-covered healthcare services. Now let's add prescription drugs. With Original Medicare, you can obtain prescription drug coverage separately through Medicare Part D. Most Medicare Advantage plans include Part D prescription drug coverage within the same plan. Many Medicare Advantage plans also offer additional benefits that Original Medicare generally doesn't cover, such as certain dental, vision, hearing, fitness, or other supplemental benefits. That sounds attractive, and for many retirees, it can be. But here's an important point. You've probably seen Medicare Advantage plans advertised with a $0 monthly premium. A $0 Medicare Advantage premium does not mean your Medicare costs are zero. You generally continue paying your Medicare Part B premium. And if IRMAA applies because of your income, your Part B cost can be higher. The $0 generally refers only to the additional monthly premium charged by that particular Medicare Advantage plan. You may still have deductibles, copayments, or coinsurance when you use healthcare services. We'll show you how those costs can add up with a numerical example later in this video. There's another major difference. With Original Medicare, you can generally see any doctor or hospital in the United States that accepts Medicare. Medicare Advantage plans often use provider networks. An HMO generally has more restrictive network rules. A PPO usually provides more flexibility to receive care outside the network, but you may pay more. Medicare Advantage plans can also require prior authorization for certain services. So Medicare Advantage isn't simply Original Medicare with some extra benefits added. It is a different way of receiving your Medicare benefits, with its own costs, provider networks, coverage rules, and additional benefits. If you remember one thing from this part, remember this. Medicare Advantage does not replace only Part A or only Part B. You remain enrolled in Medicare Part A and Part B, but you receive those benefits through a private Medicare-approved Medicare Advantage plan. Now that we know what Medicare Advantage actually is, the next question is, why do so many retirees choose it? And what are the trade-offs? That's where we're going next. Now that we know what Medicare Advantage actually is, let's look at the question that matters when you're choosing coverage. What do you gain with Medicare Advantage, and what might you give up in return? Let's start with the advantages. One of the biggest attractions is cost. Depending on where you live, you may find Medicare Advantage plans with a $0 additional monthly premium. Remember, you generally still pay your Medicare Part B premium. But compared with buying separate coverage alongside Original Medicare, a $0 or low-premium Medicare Advantage plan can look very attractive. Another advantage is convenience. Most Medicare Advantage plans include prescription drug coverage, so your hospital, medical, and prescription drug benefits may all be managed through one plan. Many plans also offer benefits that original Medicare generally does not cover, such as certain dental, vision, hearing, fitness, transportation, or other supplemental benefits. But don't choose a plan simply because the list of extra benefits looks impressive. Ask what the benefit actually provides. A dental benefit, for example, may have coverage limits, participating provider requirements, or restrictions on particular services. Another important advantage is financial protection. Original Medicare by itself does not have an annual limit on what you can spend out of pocket for covered Part A and Part B services. Medicare Advantage plans do have an annual maximum out-of-pocket limit for covered Medicare Part A and Part B services. Once you reach your plan's applicable limit, you generally don't pay additional out-of-pocket costs for covered Part A and Part B services for the rest of that calendar year. That can provide valuable protection against very high medical expenses. So, what's the trade-off? One of the biggest is provider flexibility. With Original Medicare, you can generally use any doctor or hospital in the United States that accepts Medicare. With Medicare Advantage, your access can depend on the plan's provider network. If your doctor, specialist, or preferred hospital isn't in the network, you may have to choose another provider or, depending on the plan, pay more to go outside the network. Networks can also change. That's why checking whether your doctors and hospitals participate in a plan should be part of your review every year. Another trade-off involves how care is approved. Medicare Advantage plans may require prior authorization for certain treatments, procedures, services, or medical equipment. In simple terms, that means your healthcare provider may need approval from the plan before certain care is covered. That doesn't automatically make Medicare Advantage good or bad. It means the plan manages your care differently from Original Medicare, and you should understand those rules before enrolling. Travel can matter too. If you spend several months each year in another state or regularly travel around the country, a plan's network and out-of-area coverage can become especially important. Emergency and urgently needed care have protections, but routine care away from home may work differently depending on your plan. So the decision shouldn't be based on one feature, not the $0 premium, not the dental benefit, not the television advertisement. The real question is whether the entire plan fits the way you actually use healthcare. For one retiree, lower premiums, bundled drug coverage, extra benefits, and an out-of-pocket limit may make Medicare Advantage an excellent fit. For another, broad access to doctors and hospitals and fewer network restrictions may be more important. There isn't one answer that works for every retiree. There are trade-offs. And before you can decide whether those trade-offs make sense for you, you need to understand what Medicare Advantage can actually cost when you start using healthcare. That's what we'll examine next. We've talked about the benefits and the trade-offs of Medicare Advantage. Now let's talk about something that can be much more important when you're comparing plans. What could Medicare Advantage actually cost you during the year? This is where a $0 premium can sometimes create the wrong impression. The monthly premium is only one part of your healthcare costs. First, remember that even if your Medicare Advantage plan has a $0 additional premium, you generally still pay your Medicare Part B premium. Depending on the plan, you may also face deductibles, copayments, and coinsurance when you use healthcare services. A copayment is usually a fixed dollar amount. For example, your plan might charge a certain amount for a specialist visit. Coinsurance works differently. Instead of a fixed amount, you pay a percentage of the cost of a covered service. And these costs vary from one Medicare Advantage plan to another. That's why comparing plans based only on the monthly premium can be misleading. Let's look at one simple example. We'll call our retiree Robert. Robert finds a Medicare Advantage plan with a $0 additional monthly premium. The plan looks attractive, his doctors are in the network, and it includes prescription drug coverage. For this example, the numbers I'm about to use are hypothetical. They are designed to show how Medicare Advantage cost sharing works. They are not the costs of a particular plan. Suppose Robert sees a specialist 4 times during the year, and his plan charges a $20 copayment for each visit. That's $80. Later, he needs an outpatient procedure with a $350 copayment. His total is now $430. Then Robert has an unexpected hospital stay. Suppose his plan charges $400 per day for the first 3 days of inpatient care. That's another $1,200. Add those expenses together, and Robert has paid $1,630 in this simplified example. And remember, that's in addition to the Medicare Part B premium he has been paying during the year. There could also be other healthcare expenses that aren't included in our example. So, the lesson isn't that Robert chose a bad plan. The lesson is that a $0 plan premium does not mean $0 healthcare. This is also why you should pay close attention to something called the maximum out-of-pocket limit. Medicare Advantage plans have an annual limit on what you pay out of pocket for covered Medicare Part A and Part B services. Once you reach the applicable limit under your plan, you generally don't pay additional cost sharing for those covered Part A and Part B services for the rest of the calendar year. But don't confuse that limit with a guarantee that all of your healthcare spending stops at that number. For example, your prescription drug costs follow separate Part D rules, and services or benefits that aren't covered by the plan may not count toward the medical out-of-pocket limit. So, when you're comparing Medicare Advantage plans, don't ask only, "What's the premium?" Also ask, "What will I pay to see my primary care doctor? What will I pay for a specialist? What happens if I need outpatient surgery? What could a hospital stay cost? What are the costs for diagnostic tests, imaging, or other services I may need? And what is the plan's maximum out-of-pocket limit?" Then look at your prescriptions. If the Medicare Advantage plan includes Part D, check whether each medication you take is on the plan's formulary, which is simply its list of covered drugs. Also check what tier your medication is on, which pharmacies are preferred, and whether the drug has requirements such as prior authorization. A plan that looks inexpensive on the surface may not be inexpensive for you if your medications are costly under that plan. This is why Medicare Advantage shouldn't be evaluated using one number. The monthly premium matters, but so do the copays, coinsurance, prescription costs, provider network, and maximum out-of-pocket exposure. Robert's example was deliberately simple. Your actual costs will depend on the plan you choose, where you live, the healthcare services you use, and the medications you take. And that brings us to the practical question. When Medicare Open Enrollment arrives, how do you compare all of these moving pieces without becoming overwhelmed? In the final part, we'll turn them into a simple checklist you can use when reviewing a Medicare Advantage plan for the coming year. Now we can bring everything together. If you're considering Medicare Advantage for 2027, or you're already enrolled in a Medicare Advantage plan, don't make your decision based on the premium alone. And don't assume that the plan you have in 2026 will work exactly the same way in 2027. Medicare plans can change from year to year. Premiums can change. Copayments and coinsurance can change. Provider networks can change. Prescription drug coverage can change. And supplemental benefits can change. That's why Medicare's annual open enrollment period is so important. It runs from October 15th through December 7th each year. During this period, people with Medicare can review their coverage and, depending on their situation, switch between Original Medicare and Medicare Advantage, or move from one Medicare Advantage plan to another. Changes generally take effect January 1st. So what should you actually check? Here's a simple checklist. Number 1, your doctors and hospitals. Don't assume that because your doctor participates in your plan today, the situation will necessarily remain the same next year. Check your primary care doctor, specialists, preferred hospital, and any other providers that are particularly important to you. And when possible, verify participation with both the plan and the provider. Number 2, your prescription drugs. Make a list of the medications you actually take. Then check whether each medication is covered by the plan, what tier it's on, what you could pay, and whether there are requirements such as prior authorization. Also, check your pharmacy. Using a preferred pharmacy can sometimes make a significant difference in what you pay. Number 3, look beyond the monthly premium. Review the deductible, doctor and specialist copays, hospital costs, outpatient services, coinsurance, and the maximum out-of-pocket limit. Think back to Robert in our earlier example. A $0 additional plan premium told us very little about what he ultimately spent when he needed health care. Number 4, understand the network. Is the plan an HMO or a PPO? What happens if you receive care outside the network? If you travel frequently, spend part of the year in another state, or have doctors in more than one area, this can be especially important. Number 5, check prior authorization requirements. If you regularly receive a particular treatment, use medical equipment, or expect a procedure, find out whether the plan requires approval before that care is covered. Number 6, examine the extra benefits carefully. Dental, vision, hearing, fitness, transportation, and other supplemental benefits can be valuable. But don't evaluate them by the advertisement. Find out what is actually covered, what limits apply, and which providers you can use. And finally, if you're already enrolled in Medicare Advantage, read your annual notice of change. Your plan sends this notice before the new plan year to explain important changes in your coverage and costs. Don't simply file it away. Compare those changes with your healthcare needs for the coming year. And remember, you don't have to make this decision based on advertising or sales presentations alone. You can compare plans using Medicare's official Plan Compare tool at medicare.gov. You can also contact your State Health Insurance Assistance Program, commonly called SHIP. SHIP provides free personalized Medicare counseling and is not an insurance company. One final caution is especially important if you're thinking about leaving Medicare Advantage and returning to Original Medicare. You may also want Medigap to help cover some of the costs that Original Medicare doesn't pay. But depending on when and where you make that change, you may not always have the same federal protections to purchase every Medigap policy without medical underwriting. So don't cancel existing coverage or switch plans until you understand how the change could affect your Medigap options. Medicare Advantage can be a very good choice for some retirees. Original Medicare can be a better fit for others. The purpose of this video isn't to tell you which one to choose. It's to help you understand the trade-offs before you choose. Look beyond the $0 premium. Check your doctors, check your prescriptions, understand the network, review the out-of-pocket costs, and review your coverage again every year. If you need a refresher on what Medicare Part A and Part B cover, what they cost, and what Original Medicare leaves you paying, watch our complete Medicare Part A and Part B guide next. That's the natural companion to this video. and subscribe to the Retirement Briefing for clear, practical information about Medicare, Social Security, and the financial decisions that shape your retirement. Your retirement. Our focus,